Hello and welcome to News Up Now. I am Gleidson Martins in San Francisco. So in the city, one health organization is helping people getting through this pandemic. They are also helping people to build a better future. To talk about the HealthRight360, I'm joined by my friend, Dr. Keith Lauren. Thank you so much, Doctor, for joining us.
Thank you for inviting me. My early part of my career was spent in the emergency room, actually, for almost 25 years.
Wow.
And so, at a time like this where there's sort of unprecedented crisis, it brings me into, it calls me into action, I guess is the best way to say.
Oh, that's good to have you on action, per se.
So HealthRight360 is at its core, it's an organization who is dedicated to serving the healthcare needs and related needs of the most underserved people in our cities in most of the major cities throughout California. And many are affected by addiction and have many mental health challenges as well.
So have you noticed any an increase on the number of patients during this pandemic?
So just to be clear about my role in the organization, I'm practicing in the medication assisted treatment side or addiction medicine clinic. And so in our, there's always been a lot of patients in need. And to the extent that people are not afraid to come in and ask for services, we're still seeing a steady stream of people. And I think also what we're seeing is that it's become very destabilizing for the majority of people struggling with addiction and mental health.
How so?
At the core of all mental health challenges, of which addiction is one, is trauma. And when I say trauma, I mean early childhood experiences, adverse early childhood experiences. And so when children grow up in an environment where there's adversity and there's not nurturing, there's not support, their biology kicks in and they manage to survive sort of unconsciously. And those mechanisms within themselves that got them through childhood don't serve them so well as an adult. And when there's adversity, they're triggered.
What do you see when people come into the clinics? Because I noticed you have the clinics HealthRight360 accept walk-ins too, right?
Correct. Yes.
So do you see them either protecting themselves or not?
It's a mixed bag, just like you see amongst the general population right now. I think if you've been out to the grocery store or pharmacy, you'll notice that not everybody is wearing a face mask, and everybody has a different sort of interpretation of what their personal space is. And so we're seeing the same thing. And I would say that to their credit, I mean, not to, just like the rest of us, just like all of us, the folks that are coming to us, some are wearing face masks, some aren't, perhaps fewer than others. But I'd say on the whole, they're actually pretty well informed.
Mm-hmm. Yeah, I guess we are all in the same boat, right? I mean, but I think what I'm wondering is, are those people who have some sort of addiction, and some of them they don't have a place to sleep on, to be like a house. That's what I'm wondering, like how they are dealing with this pandemic, because it, as you said, it's crucial times, and it doesn't seem to be over soon.
Yeah. Well, there's a number of things going on. Some good, some hopeful, some not so good. Some that have not worked are not working so well. There's a much greater desire to get into a safe living situation. And one of the things that we did, so to be more specific about what we do at HealthRight, we provide addiction services. We provide addiction medical care, but we also have, for instance, in San Francisco, we have two very large residential substance abuse treatment facilities, known as Walden House. There's two places.
Mm-hmm.
And we initially thought, oh, we need to lock them down to keep our clients safe that are there. But then we realized that there's a greater need for the people who are even less safe out in the streets, and that we need to stay open and set up protocols that allow us to bring people in under quarantine that are ready to engage in substance abuse treatment. So we've actually, I don't, and I don't know the specific numbers, but we kept the doors open. Let me just put it that way.
Mm-hmm.
I couldn't give you numbers because um, that's not my pay grade. But I do know that I've been seeing clients continue to see clients who are new, who are seeking refuge and treatment, and we're placing them when a bed's available. And we
That's
have,
wonderful. That's a
yeah.
fantastic work. Thank you for doing that. So is that any difference when it comes to treat addiction, while we have this pandemic?
Well, I think there's an even greater need for the reasons I stated before. This is a highly triggering time for anybody whose resilience is being tapped.
Mm-hmm.
And the most likely people whose resilience is going to be tapped beyond their ability to, their emotional ability to cope with things, are going to be people who hold on to childhood trauma. And so that by definition is what drives addiction and severe mental health.
Are those screenings like checking the temperature of someone is really 100% accurate? Because there's some people, they don't have any symptoms of COVID-19, right?
Of course not. Of course it isn't. But we would be, you still want to screen everybody in case somebody does come in with a fever and doesn't know it, or whatever. But the screening is much more, it has really more to do about symptoms of respiratory, of flu-like illness. And so, yeah, if a quarter of patients who get COVID have no symptoms, that is why it spreads. It has spread so rapidly and so quickly across the world. There's no question.
So
So
what do you think about the social distance then?
that is our defense, period. End of story for now. Here in San Francisco, we've done an amazing job. And it really is because people have taken the stay-at-home order seriously and social distancing seriously. We're seeing a very, very gradual increase in cases. Today, I sat in on a phone call with representatives from every hospital in the city, every emergency room, and we've been doing this weekly. And they continue to report that ER emergency room patient volumes are down 30 to 50% from normal, and a three hospital system reported that they haven't had any new COVID cases in the last 2 days. And the numbers in San Francisco are just sort of slowly rising, and they're expected to peak, whatever that looks like, in a week if things stay the way they are.
Oh, those are really good news. I mean, just to have the number of emergency rooms going down, that's really, really good news.
They've been that way for the last 3 or 4 weeks, ever since the stay at home, because people have stayed away. The other interesting thing is that, social distancing has created a situation where all other communicable diseases have gone down, or at least people aren't going to their doctor for it.
Right, my friend, thank you so much for your time. I truly appreciate it. I know you have a day off.
A busy day off with keeping up on the epidemic, but
I know,
thank
right?
you for
Yeah.
having me. I appreciate it.
No, I truly appreciate your time. Thank you so much. And I hope to see that garden soon.
Oh, okay. You're
Thank you, Keith. I appreciate it. Have a great day.
welcome. You're
Thank
welcome.
you.
Bye, Gleidson.
Thanks. Bye-bye.
Bye.
And thank you so much for watching. If you have any questions, please let us know at tips@newsupnow.com. And I hope to see you next time. Be safe.